Hi, my name is Sarah Eben, and I'm here today to talk to you about instituting a new EMR. As medication errors increase in the organization, we have been tasked with selecting an electronic medical record with electronic prescribing software to reduce those errors. Today, we will discuss the impact of an EMR on safety, the cost and benefits of an EMR, and an integration, evaluation, and sustainability plan for implementing the chosen electronic medical record. Last, we will discuss the benefits of the specific EMR that has been chosen. The first thing that we need to address is patient safety. We need to ask the question, how will an EMR increase patient safety? The answer is simple. It will help reduce the number of medication errors that occur every day, in turn reducing adverse effects and other negative patient outcomes that result from medication errors. The decrease will be due to safety precautions that are built right into the EMR. First, there will be a decreased prescription transcription errors due to the increased legibility and efficiency with writing those medication orders. These orders are transcribed and approved quicker, which helps the pharmacy prepare and dispense them faster so that the medication can get to the patient quicker. Third, with many EMRs, medication administration includes the process of scanning barcodes of the medication and the patient bracelet to ensure the correct patient. This will also yield a warning in many EMRs if there is an error with the scanned medication. That could be the wrong patient, the wrong dose, or the wrong time. These systems are, by design, an efficient medication reconciliation tool that will ensure the patients are receiving the medications appropriately. This chart from the article Medication Errors, Prevention Using Information Technology Systems by Abha Agrawal in 2009 shows that even then, it was apparent that the use of technology, such as computerized physician order entry, barcode medication administration, and electronic medication reconciliation, were all ways to prevent medication errors. The use of a computerized physician order entry system can reduce errors by 55 to 83%. Later in the presentation, we will discuss the cost of these errors. A 2017 study by Seetal Gita and Byron Dean Franklin observed the reduction of medication errors with the use of electronic medical records. There was a reduction in missing information that happens with handwritten orders. Most EMRs have hard stops that require all the dosing information is entered before it can be signed and approved. Handwriting is not a problem this way either, but there is still a risk of human error, and the prescribing practitioner could enter the wrong medication by mistake. This can happen when the medications auto-populate with adding a few characters. So it is still important to look closely at the chosen medication. The EMRs also help dosing liquid medications more accurately by using dosages versus volumes as the prescribing information entered. If the medication is entered with dose per volume and the dosage ordered, the system will calculate the volume needed, reducing errors made by clinicians trying to figure out the dosage volume themselves. These electronic prescribing systems also help reduce errors by checking interactions, allergies, and lab results, alerting if anything is not consistent. Medication administration is also an area where errors often occur. EMRs generally have warnings built in that can decrease the risk for those errors. Examples are an EMR that gives a warning that a medication is being given too close to the last dose, or requires a second person to verify a high-risk medication before it's given, or a blood pressure needing to be entered with each dose of blood pressure medications given. The scanning of a patient's bracelet and each medication helps ensure that the right medications are being given when the right patient at the right time, in the right dose, and the right route. In November of 2020, research done by Angela Hansen and Lisa Haddad showed that barcode administration has been shown to decrease the incidence of medication administration errors, ranging from 23 to 56%. This is also real-time documentation of the medication administration time, so there are less errors in giving medications too soon again. Van Wilder et al. In 2016 noted that one of the benefits of an electronic medication prescribing system is that the timely administration of medications improved, which was a potential safety benefit. Medication lists are also likely to be more accurate if the chosen EMR integrates with both internal and external pharmacies. If used, there will be a reduction in duplication errors. Medication lists are updated immediately, and there is no wait time for the order to be transcribed and approved. As the physician enters these orders, they are automatically integrated into the patient's record. There are also many systems that do an automatic check for interactions and medication allergies that will alert the prescribing physician or the nurse doing a medication reconciliation right away. It is important that allergies are listed accurately for this to be helpful. In 2019, amcp.org stated that when patients know and understand their medications, they can help prevent errors. When patients participate in their health care and have the proper knowledge about their medications, they can help safeguard against errors with this knowledge. Many EMRs will have education materials built in. An example is the EMR Epic. They have a web-based database of pre-approved electronic patient education materials that can be printed and given to patients. So now let's talk about how the cost of the EMR will lead to increased revenue and decreased lost payment because of medication errors. HealthIT.gov broke down some of the costs of implementing an electronic EMR. There will be hardware costs, including servers, computers, laptops, printers, scanners, etc. The software itself will have a cost, along with any associated interface applications that may be needed. Those interface applications could include lab, pharmacy, both internal and external, and with other organizations. There will be the cost of the implementation assistance of any needed IT contractors or contractors to help with chart conversions, installations, and workflow redesign. There is a cost to train staff from physicians to support staff, both initially and throughout the implementation. There will be ongoing costs, such as licensing and hardware costs and agreements, ongoing staff education, and possibly IT support fees. There may also be new staff needed due to the new EMR. IT staff or data or application analysts may be needed for ongoing support. For the EMR Epic, the Pricer.org website estimates that the cost for a larger medical facility to implement Epic is around $500,000, with monthly costs that can vary from $200 to $35,000, depending on the contract and configuration. These things can be very costly depending on the system chosen. The next slide, we will see why this cost is necessary. According to amcp.org in 2019, medication error, morbidity, and mortality costs were around $77 billion per year, and medication-related injuries were at least $3.5 billion a year. They also stated that EMRs not only can help reduce errors, but the use of prior authorizations for medications, which can be part of an EMR's functionality, can help lead to reduced costs as well. CMS has also announced the implementation of value-based purchasing for hospitals and other health care organizations. This program rewards hospitals based on the quality of care that is provided to patients, so the reduction in medication errors will help the organization's final score, hopefully resulting in a higher payment. Of course, the most important piece of that is always patient safety. Another cost benefit is that the EMR reduces the number of touches that it takes to handwrite a prescription, transcribe it, and get it to the pharmacy and into the nurse's hand to administer. The automated system can help reduce the need for administrative staff, which is another cost savings. And now we will talk about the integration, evaluation, and sustainability plan. With the new EMR, the medication policies will need to be reviewed and updated to include the new procedure. Staff need to be educated on the new policy and sign an attestation that they have reviewed and understand the changes. As the implementation continues, the policy and procedure will continually be reviewed to make sure any changes are appropriately made. Here's our implementation plan timeline. First, you will see there is staff education that will be provided that is both unit specific and discipline specific for how to use the new EMR. A start date for implementation will be determined and communicated once it is finalized. Until then, we will continue to promote the new EMR at staff meetings, unit huddles, and in any other staff communications. Repetition increases awareness and encourages staff to be excited about the new system and its capabilities. Once staff is trained and we go live with the system, there will then be a 6-month review of how the EMR is working and if it is helping to reduce medication errors. If rates have not been positively impacted, re-education will need to be done to ensure it is being properly used and the EMR can be reviewed for system updates that may be needed. Last, we will have a 1-year review of outcomes and again reassess the effectiveness of the EMR. With the continued review, we continue to evaluate the sustainability and ensure we are working toward that. Implementing a new EMR is a big job and takes teamwork and coordination to become an efficient tool to help reduce errors and increase patient safety. So which EMR did we choose? After much research into EMRs, the organization has chosen to go with Epic as the EMR of choice. So why Epic? Among the many reasons Epic was chosen, the most important are outlined here. Epic.com lists the many services provided by Epic that will increase the success of the implementation and use of the new EMR. Epic EMR integrates between health systems and pharmacies worldwide. According to Epic.com in January 2018, approximately 2.3 million records are exchanged every day, and over 2/3 of the population of the United States have a current Epic chart. Think about how this can reduce errors by the efficiency of the real-time exchange and update of the patient's records. Epic will also provide trainers and work with the organization to put into action our implementation plan. As the organization uses the EMR and notices things that may not be appropriate for them, Epic can customize the system to meet the organization's needs. This is important because we need to ensure that our processes are in line with our desired needs and outcomes. With the 24-hour-a-day, 7-day-a-week support of the Epic technical support team, issues can be taken care of real time. Within Epic, there are integrated analytics for reviewing outcomes and other data that is used in quality improvement plans and day-to-day operations. Epic also provides standardized documentation to ensure all the regulations are being complied with, as well as standardized medication prescribing to reduce errors during that process. In summary, we know that medication errors are a top risk factor for patient hospitalizations and other adverse effects. Putting an electronic medical record system in place is a key intervention to improving patient safety when it comes to prescribing, transcribing, and administering medications. Many factors go into researching and choosing the best EMR for the organization's needs. During the presentation, we saw that the cost of medication errors far exceeds the cost of the implementation of an electronic medical record. Although it takes time and a lot of effort, the benefits to the organization, the patients, as well as the organization's staff are well worth the cost. Here's a list of references for materials used in the recording today. Thank you for listening.